When it comes to healthy aging and energy metabolism, both coffee and green tea are more than just cozy beverages. They're functional drinks packed with bioactive compounds that nudge your cells into stress-resilient, longevity-friendly behavior. And one of the key targets of both drinks is AMPK, the cellular energy sensor that promotes fat burning, autophagy, and metabolic efficiency. But which one does a better job at flipping that molecular switch? First, let's look at coffee. The primary active ingredient is caffeine, a well-known stimulant and one of the most reliable natural AMPK activators. Caffeine indirectly activates AMPK by increasing intracellular calcium and altering the AMP/ADP ratio, both of which are signals that cellular energy is low and it's time to shift into conservation mode. Studies show that caffeine stimulates AMPK in skeletal muscle and liver, promoting glucose uptake, fat oxidation, and improved insulin sensitivity. This mimics the metabolic effects of fasting or exercise, and may be one reason why regular coffee consumption is associated with reduced risk of type 2 diabetes, cardiovascular disease, and all-cause mortality. But coffee doesn't stop at caffeine. It's also rich in polyphenol, especially chlorogenic acids, which have their own anti-inflammatory and antioxidant effects. These compounds may support mitochondrial health and improve endothelial function, both of which are tied to AMPK signaling. Coffee also appears to reduce DNA damage and suppress mTOR activity in some studies, reinforcing the idea that it nudges cells toward a stress-resistant, longevity-promoting profile. Now, green tea brings a slightly different, more subtle profile to the table. It contains less caffeine, typically about 25 to 35 milligrams per cup versus 80 to 100 milligrams in coffee, but it compensates with a unique arsenal of compounds, most notably epigallocatechin gallate, EGSG. EGSG is a potent polyphenol with demonstrated AMPK activating effects in both animal and cellular models. It activates AMPK through both energy stress signaling and direct interaction with upstream kinases like LKB1 and CAMX. Studies suggest that EGCG helps reduce liver fat, improve insulin sensitivity, and enhance fat metabolism, partly by mimicking the same nutrient-sensing responses that caffeine does, but without the overstimulation. Green tea also has L-theanine, an amino acid that promotes calm focus and may counteract some of the excitatory effects of caffeine. While L-theanine doesn't directly activate AMPK, it helps modulate the nervous system in a way that makes green tea more tolerable for those with caffeine sensitivity. This makes it a gentler choice for long-term use or for individuals who experience anxiety or disrupted sleep from coffee. So, which is better for AMPK activation? It depends on your physiology and your goals. If you're looking for a stronger metabolic push, coffee wins for sheer caffeine content and its robust impact on liver and muscle AMPK. It's ideal for morning activation, fat oxidation, and stimulating mitochondrial turnover. But it also comes with a higher risk of tolerance, sleep disruption, and overstimulation if overused. If you want a subtler, more sustained effect with added antioxidant and anti-inflammatory benefits, green tea shines. EGSG's impact on AMPK may be milder but longer lasting, and green tea tends to produce less cortisol elevation than coffee. It's also an excellent choice for cardiovascular health, cognitive support, and metabolic flexibility without the roller coaster energy curve. From a longevity standpoint, both beverages have been associated with reduced mortality and chronic disease risk in population studies. Coffee drinkers often have better liver and cardiovascular profiles, while green tea drinkers show lower rates of metabolic syndrome and cognitive decline. The overlap likely comes from their shared ability to activate AMPK and modulate key aging pathways like oxidative stress, inflammation, and autophagy. The truth is, you don't have to choose. A balanced approach. Coffee in the morning for an AMPK kickstart, green tea later for sustained support, might be the best way to ride both metabolic waves. They take different routes to similar outcomes: improved energy metabolism, enhanced stress resilience, and a longer health span, one cup at a time.